you look on, say, anatomy books, they go from C1, C2, and they stretch all the way down the anterior. This is the anterior part of the neck vertebrae, and we've got one here. Thanks. Yeah, this. Really? Wow. Okay. I don't know whether Jules, can you get in on the camera on that one? You got one? Actually, that one looks a bit better. It's less bloodthirsty. You got it?
Yeah.
Okay, that's good. Please. And then we can pan back to me. Did everybody get a bit of a squiz at that book? Jules, you want to just turn around for a sec? That book shows either side of the vertebrae on the neck. And they go down all the way down to about T3. They'll attach down there as well because they've actually got a pull. What they do, amongst others, but these are the main ones, is they pull the head forward. They're attached to the neck. There is another one which goes from the neck vertebrae up onto the base of the skull. It's sort of up inside, and if you were to anchor the neck and try to stop the neck moving, the other muscle will actually nod the head. But when people tip their head forward, it's the longest colli muscles which pull it forward. Those are the important ones. This is your book. Thanks, Patrice. Now, we're still talking muscles at the moment. So, one of the things that I'm going to show you today is various techniques to loosen those muscles. Getting to the longest colli muscles with acupuncture is impossible, unless you're real brave, and I'm not. I've never stuck a needle in there that deeply, straight in there, but I've seen it done, but I won't do that yet. So what we're going to do is some massage and stretching techniques which loosen them up. And this technique is useful for all the work that I do. I've studied a lot of massage techniques. I've started out doing Swedish massage and then a bit of Rolfing. You know what Rolfing massage is? Yeah? No? It's Rolfing is otherwise known as pinch-pull massage. It's sort of where you get a bit of skin and you do this with it. And it's very like cupping. When you think what a cup does, one of our vacuum cups, they suck and they do this because there's nerve reflexes in the skin. Hi, g'day. There's nerve reflexes in the skin which will work deeply and loosen muscles underneath. And so anyway, I studied the Rolfing stuff. I've done Bowen massage. Who knows what Bowen massage is? Good. A couple of people. Bowen massage works on muscles, recognizing that it's a fascia-based muscle technique. Fascia has stretch receptors in it as well. So I always say to people, fascia is like sausage skin around a muscle. So this is the fascia, and this is the muscle in here. So when people do Bowen technique, they usually do it in the belly of the muscle, and essentially what they do is they pick up the fascia, stretch it one way, let it go, and stretch it back the other way, and then let it go. But with Bowen, they don't need to use a lot of force. So any Bowen practitioner that uses force, as in, gets stuck in and does this, and then pulls it back, doesn't know what they're doing. So Bowen works extremely well. Tom Bowen was from Victoria. He developed this technique, and he maintained that you shouldn't combine it with acupuncture. I have no idea why. So the first day after I did the course, I combined it with acupuncture and I got great results. So, hey, what the hell? Anyway, that Bowen massage is cross-fibre massage. Most other massage is along a fibre. Now, most massage also, I also did, as well as the Swedish, the normal sort of massage, the Bowen stuff, the Rolfing. I did muscle energy technique stuff as well. You know about that? Muscle MET, muscle energy technique? No? Okay. It's a stretching of muscles whereby you might get a patient to tension a muscle against resistance. If you want to loosen, say, a bicep, you get them to stretch it against resistance and then let it go. Excuse me. And then what happens is the muscle, because it's been stretched, this is in theory, because it's been stretched, it will let go and relax a bit more. So then you have another go at it for about 10 seconds, and then the muscle will relax even more. Jumping to tomorrow, but I'll jump briefly to tomorrow. The psoas muscle has always fascinated me, and I had worked for ages trying to get the psoas muscle to let go, and I used to do this muscle energy technique on the psoas muscle with the patient lying on the couch. This is one I developed, and let's say I was working on their right side, I'd have them sort of lying close to the edge of the couch with their right leg over the edge of the couch, and I'd stabilise their body, I'd lean on the leg and tell them to pull up against resistance, sort of holding them down like that and stopping them from falling off the couch. And gradually it would work and the leg would drop, and I'd measure it by how far the leg was above the floor as they lie on the table. And hey, it worked, but it wasn't brilliant. And it used to bug me that I couldn't get the psoas to release using that technique. I'll talk more about that tomorrow. Now, I'll tell you what I did. In muscles and their associated structures, there are Golgi tendon apparatus. Yeah, you know about those? Yes. There are spindle cells, and again in the fascia, there are like stretch receptors. Now, the whole point of those is that the brain at all times knows what a muscle is doing. So it's the amount of nerve transmission that the brain does to coordinate muscle movement and to set muscles with tension is just phenomenal. When you think about all the muscles that we've got in our body, they're all set. They've all got a particular tension. They all are allowed to move through particular routines that they do. But if they're set incorrectly, this is where problems start. So let's say someone has got a bicep. Just let's say they've got a bicep problem. What the bicep does, obviously, is it lifts the arm. Now, there's always an antagonist muscle. This is the key to this. There's always an antagonist muscle. So the antagonist to the bi is the tri. Yep. Okay. Let's say the bicep muscle is set to a particular tension. And the brain sets muscles to tension all the time. That's how we work. Okay, so the tension is set. Let's say the tension is set 10% higher than it should be. To stop us smacking ourselves in the mouth, the tris have to be set 10% tighter than they normally would. Okay. Who knows about chronic fatigue? Chronic fatigue syndrome. Just think about it. Chronic fatigue. What is used to make muscles work? It's obviously energy, isn't it? ATP and all that sort of stuff. Yeah. Now, let's just look at chronic fatigue from a slightly different point of view. I know this lecture isn't on chronic fatigue, but this is just throwing things in for you to think about and develop yourselves, perhaps. Where someone's got chronic fatigue, they know, people with chronic fatigue know that they have got points all over their body which are sore. Gallbladder 21, they all know that one. And they've got gallbladder 20, it's always sore, and they've got various dotted points down the back, down the erector spino muscles. They've got points on the quads that are sore, bladder 57, 58. They're all sore. And if you have anybody that's got chronic fatigue, they'll have the chart and they'll know where all the points are. I have patients like that. And over the last year or so, I've gone lateral in thinking about chronic fatigue. Why have they got chronic fatigue? Because their bloody muscles are so tight. They're burning themselves out. They're using all their energy with muscles that are so bloody tight, they just can't function properly. People are so weak, they just haven't got the energy to walk around because all their energy is locked in these muscles. Now, I went through a muscle cramp, something I had for about an hour. I had a really bad muscle cramp for an hour, and it was so bad that I think I was going to have to go to hospital and get it sorted out, nearly to the point of vomiting and fainting. The spasm was that bad, and I couldn't break it. I eventually did, but I was in major drama for an hour. For the next 2 days, I was exhausted. And I thought, God, just that one muscle being a spasm has wiped me out for a day. And I thought, I bet chronic fatigue works the same way. Anyway, I'll go more into that later, and I'll explain how to loosen muscles as well, and another way. I'll do it now. Loosening muscles. Contract the opposite muscle against resistance. You know that? How to break a spasm. Contract the opposite muscle against resistance. So let's say a footy player has got a cramp in the calf. The calf is cramped up and they're lying there in agony. If you apply the principle, contract the opposite muscle against resistance, the opposite muscle, in other words the antagonist, advance. Okay? So what one does, knowing what those muscles at the front do, is pull the foot up like that. You get the poor bugger on the ground you tell them, I want you to do what I want you to do. Okay? You hold their foot and tell them to try and lift up against your hand. Okay? This one contracts. The opposite muscle has got to let go. That is hardwired into our heads. So any muscle that's tight, you can use that principle for. And this is a lot of the principle of the work that I do is based around that. You contract the opposite muscle against resistance, and the problem muscle, the calf, lets go. And that works. It's really good. It's real quick as well. And it always intrigues me watching sports people trying to massage, as in sort of medico type, I won't say medicos, sports helpers, the masseurs in the team. This guy comes in with a cramp and they hammy, in the calf, and they're in there and they're banging it and trying to loosen it up like that, and it might take them 10 minutes. You can let go of cramp in 10 seconds by doing what I've just told you. It is so quick, and it just breaks the spasm. It's great. Okay, now, so the poor old brain's got a muscle that's really tight. It's got it set, and so the opposite muscle is tight also. Now, one of the best ways that I've found for doing, apart from contracting the opposite muscle against resistance, which is wonderful, the best way that I've found to do this is to stretch a tendon of a muscle. When the muscle is tensioned, so let's say we're looking at our splenius cervicus muscle, and I get a patient to sit on a couch with their head tipped forward. Now, what that does, head and neck tipped forward, what that does is stretch the muscle from, we'll go and show Rastus here, when, it's not very flexible, but that muscle, again, goes from C1, 2, 3 and 4, and then it sort of misses these here and then attaches onto T1, 2 down to T7, attaches on each. So if you have your patient here and they've got their head sort of tipped forward and they're bending forward, and we'll go through this, and you start stretching, this is how it works best. And you stretch the tendons or the attachment point of the muscle to the bone to get it to loosen. If you do massage and you want to get good results, do that. Tension the muscle. So if you've got a patient on the slab and they've got a tight back and you're doing massaging on the back, you're wasting your bloody time. Really, it feels good. I call that stuff bedroom massage because that's where it should be. It's not therapeutic, really, in my opinion. So I will show you specific techniques tomorrow for the back stuff, but for the next stuff I'm going to show it to you shortly. It works when the muscle is tensioned. So what works best are the Golgi tendon apparatus, because this is how it works. This is what goes on up here. Okay, what muscle we use? Let's say we're using the bicep insertion. Okay, so what the arm is straightened, so the muscle is as long as it can be, maybe with the arm out like so. And you put your thumb on the attachment of the muscle, either up here or down here. But for the demo, I'll just use here. So what's happening now is the muscle is at a certain tension. And the brain knows what that tension is. And it's got it set. It knows where it should be. But it's too tight. But the brain's got it wrong. And consequently, it's causing a drama. So what you do is you tension the tendon. Now, the Golgi tendon apparatus goes, holy Moses, I'm way too tight. So it sends the message up to the brain, and it says, I'm way too tight, it's hurting. So the brain says, okay, dude, let go. So it sends a message back to the brain, from the brain, down to the body to let go. That's what happens. So what we're doing is we're fooling the body into doing what we want it to do and putting it back to where it should be. That's the whole purpose of this stuff. Does that make sense? Okay, that's good. So doing a massage on somebody where they're not tight, where they're not tight or a muscle isn't tensioned or taut, not to the point of it hurting. Obviously, if someone's in a lot of pain, they can't bend too far. But if they can bend only, say, so far, you work with them in that position, and there are various ways of keeping people in that position, which I'll show you. And so when you do that, then you are the most efficient you can be. And that's the best way of being. Now, don't forget that. Now, the flagpole. Te Tiriti o Waitangi, Treaty of Waitangi. Old Hongi was dead set on chopping the flagpole down, and everybody knows that the flagpole. You've all been up to Waitangi? Yeah, seen the Waitangi flagpole? Anyway, it's got guy ropes holding it up. What is the minimum number of guy ropes that you would need to hold a flagpole up? 3. Right, that's cool. 4 work better. Ask any yachtsman. And what happens is, let's say you have someone that's bent forward, like so, or if they've got a crook back, because I'll use this example tomorrow, but I'll tell you now. If someone is bent like so, they have a problem. Let's say they have a problem in here that may be pulling them forward. What happens is these muscles on the opposite side have to work a lot harder to hold them up. Okay? So wherever you have one group of muscles, say in spasm, let's say the longest colli muscles in the neck are tight, and they're pulling the head forward, the muscles at the back of the neck are going to be tight. They have to work against holding our head up, which is, 5 kilos? 4.5, 5 kilos, average our head, maybe a bit more. Okay, so you've got the head tipped forward, being pulled forward by these muscles. Naturally, these ones on the back are going to overwork. That's why they hurt. When people come in and say, the back of my neck hurts here, or we'll do it on Cedric over here. People are saying, okay, I'm hurting up here. So you're thinking, okay, levator scap, maybe splenius cervicus muscles, maybe posterior scalenes. Why are they hurting? Because they're tight and they're overworking. Why are they tight and overworking? Because the opposite muscle is too tight. Longus colli. So I've got this phrase, as above, so below. As above, so below. And if you remember that, it's a really good principle to work with, because what happens at the back is happening at the front. Okay? What happens in the hammy, if somebody's got a really tight hammy, the opposite muscle is the quads. So where there's a tight hammy, we might check it out, ischial tuberosity and a bit of prodding in the general region of the hammy. But okay, why is it tight? Maybe the person's overworked it, but the other possibility is, and never overlook this, that their opposite muscle, the antagonist muscle, is too tight. So the poor old hammy is having to pull against the antagonist muscle. And this will get you out of a lot of tricky spots, because you will find that when you have patients that have come in and they've seen other practitioners, chiropractors, physiotherapists and sports masseurs, people and so on, and they have got no results. Obviously, if it was an easy fix, it would have been fixed. So whatever it is has been overlooked. And what usually gets overlooked is the antagonist muscle. And that's the best way that I have discovered of fixing problems. So, patient comes in with the stuff, say on the back here, that's hurting. I'm thinking, okay, longus colli, and maybe there's sternocleidos as well, but usually I don't worry about those because, like I say, they don't always come into the equation for me. Now, what I do then is I use the technique of contracting the opposite muscle against resistance. So, I've worked out over a number of years the best way of doing this sort of stuff. So, patient comes in and tells me their problems, and first off, you usually got to go where the pain is. If you don't, people think, this guy doesn't know what he's talking about. So you say, okay, you've got some pain and discomfort up in this area here. Let's check it out. Let's feel what's going on. So normally what I'm doing is I'm palpating this person's back, and I'm finding out, oh yeah, you've got a sore spot there, you've got a sore spot here. Yeah, that's cool there. And maybe on the other side as well, there's a little bit over there. And so I get my non-toxic pen out and put a few X's on their back and up on the neck as well. And then I might do a little bit of stretching on the back, just to sort of show people that I know what I'm doing. But knowing all the while that this opposite muscle is probably the one that's causing the dramas. It doesn't always happen that way. If someone's overworked themselves, fatigue, overwork stuff, that's going to cause a problem in here. It doesn't always happen that the opposite muscle is the problem, but many times it does. So I'll start working on this individual on their back, and having palpated the neck as well. This is really useful. Palpating the neck, you find the transverse processes on the neck, which are easy to find because they're usually sore, and we'll do this shortly. So we've got this individual with sore spots here. So you might find on the right-hand side of the neck, put a couple of X's there, and you say, right, you're sore there, aren't you? And the person says, yes, I am. Okay, go ahead, do the stretch on the back a couple of times, and it usually takes a minute or two for muscles to get the message and then send the message back that they're going to let go. And what I find often is when I'm checking the side of the neck again, that on the transverse processes, maybe C2, 3, 4, that they're not as sore as they were. So if that's the case, you know you're in the right ballpark. And then it's a matter of taking it from there. One thing to remember also is if you've got, say, spasming, say on the right side, the head is going to want to tip that way because the muscles are tight. Be aware also that there could be a problem generating or being generated on the left side, that the head needs to be pulled back, because we have this built-in mechanism in us that says you've got to have your eyes straight. That's why people get seasick, because there are two mechanisms. You've got the middle ear problem, you've got the the inner ear, where all the balanced labyrinths are, and then the eyes. And when there's a conflict between that and the eyes, that's when we get sick. And seasick is a great one for doing that. Airsick, not too bad, but sudden movements. The balls go this way and say, hey, I'm like that, and the eyes are saying, no, you're not, you're like that. And so there's a conflict, and that's what usually generates sickness. Gallbladder 12 is a good point for fixing Meniere's. You know, many people treat Meniere's. Yeah, okay. What I've found is over the years that gallbladder 12 and gallbladder 20 are quite useful for treating Meniere's. Those are the major points that I use for treating that. Also, I think it's small intestine 19, is it? Just in here. Deep, about 1.5 inches deep if you can get it in that far. And get good chi, radiate it, and that'll be useful for that. But balanced stuff, it's usually why. There's those points, gallbladder 12 and gallbladder 20, and I think small intestine 19, have a fairly major bearing on the middle ear, the balanced stuff. It's quite good for that. However, I've digressed. Okay, there's one last thing a couple of last things I want to tell you about neck problems. C1. If a problem is at C1, often it's husband and wife. C2 is further out, as in kids. C3 is even further out, like grandkids or someone else in the family. C4 is work, and C5 is the boss. Okay? Sounds crazy, but that's it. So when somebody comes in, and this is very useful. If you remember this stuff, it's quite useful because let's say someone's got really super tight below gallbladder 12, and you think, okay, you're palpating the bottom of the mastoid, and you're also looking for the TVP, transverse process TVP, of C1. Now, normally C1 is pretty close to directly under the mastoid, but where people are really sore, when you palpate up in that area, you'll find that the C1 has rotated, and it's usually sore on the side where it's further away from normal. Again, gallbladder 12, gallbladder 20, or local points, Ashi points, are really useful for sorting that stuff out. But when you're palpating somebody and you find that they've got a C1 problem, someone that maybe is, you're thinking, okay, why's this person got a C1 problem? You check the rest. They're not too bad. Maybe C2 is a bit touchy. The rest aren't too bad. Why? So at the bottom of your mind, you're thinking, okay, husband and wife stuff. Okay, maybe someone's going through a divorce or thinking about going through a divorce or has just gone through a divorce. And knowing that can be very useful when you treat that person. You might ask them, you might say, how's things at home? You know, getting on okay with everybody? And they go, okay, we know what's going on. So, oh yeah, been down that track. Yeah, know a bit about that. And it helps to relate that I've been divorced twice and gone through a couple of other stormy situations, and I'm very happy now for the last 10 years. So I don't have a C1 problem. I may have a C2 or a C3 problem, but not a C1. So you'll pick it. You'll pick this stuff. So C1, husbands, wives, lovers, problems with. C2, closer, family, like brothers or sisters. C3, that's further out family, like grandkids or uncles and aunts and stuff like slightly further out. C4 is work, and C5 is the boss. As in, if someone's at work, they like their job, so it's not a C4 problem, but a C5 problem. The boss has given them a real hard time. Do this, do that, or, you know, you've got to be nice to the boss, sort of thing. And they like their job, but they don't like what the boss is doing to them. That'll be a C5 problem. It's not the only reason for a C5 problem. There might be a front row hooker, or as in, football. And sorry, yeah. So when you're treating people, it's useful to know this sort of stuff because then you can maybe use some Shen calming stuff. You may be able to use some points which help that person get through some tricky stuff. So you'll know what the gallbladder, liver and gallbladder stuff is about, planning and decisions. You into spiritually sort of stuff like that, the finer aspects of it? Okay, that's good. For those that aren't, the liver and gallbladder are planners and decision makers of the body. So let's say someone is having difficulty making a decision, agonising over a decision. Gallbladder 34 is a really useful point for treating to clarify, or maybe liver 3, but to help somebody clarify an issue and therefore help them make a decision or help them through that part of their life that is causing this problem up here. Rather than sticking 1,000 pins up here, you might be able to get away with just using 1 or 2 gallbladder 34, liver 3. And that'll really help. So knowing what's going on in their life by C1, 2, doing this sort of husband, wife, boss, work, etc. stuff, that really helps you to be more of a broad practitioner. Some years ago, I had an old bloke come to see me. His wife had been to see me first, and she wasn't real flash. The old fella came to see me, and he had his wife sort of shoved him into the clinic, and he sat down. He's a big man. He sat down, he'd be about 60, 65, big, solid, strong man. I said, "What's the problem?" He said, "Nothing." Okay. Okay, your wife thought it might be a good idea you maybe have a bit of a tight neck. Oh, yeah? So, okay. Well, you got a bit of neck stuff happening. Yeah. So, okay, let's check. So I got him in the position to check his neck. I just palpated. C1, rock hard. C2, rock hard. C3, rock hard. Traps, rock hard. Oh, God, the lot. Okay, so we'll start out. So I said, okay, tilt head forward, put my hand on his chest, and started out working. I got up here and did a little bit of loosening up. I said, what is happening for you? You are so tight. I said, where do you live? And he said, on Stradbroke Island. Well, Stradbroke Island's a big sand island it's a lovely place, beautiful beaches, just off Brisbane, magic place. It's about 60, 70 kilometres long. Okay.